Hi, it's Dr. Vasquez again, and I'm here to talk about the last segment of our three-part series on breast augmentation and breast implant surgery. And we're going to go into a little bit about what to expect after surgery, what activity, um, but I'd really love to talk about a unique technology that I brought into the office that not too many people in the area have. It's called a Chrysalix software, where not only can we simulate what implants look like in the body, but we can be really very tailored to your needs and wants by putting the exact CCs, the type of implant underneath the muscle, on top of the muscle, and we can have a great discussion about what's really going to achieve your goals. So I have here one of my patients, um, a lovely young girl who wanted just to provide a little bit of self-esteem and just enhance her breasts with breast implants. So one of the concerns that she had, which a lot of people have too, is what am I going to look like after surgery? How can I really envision what that's going to be? And a lot of anxiety is there, and this software really helps allay those fears, make you feel comfortable about your choice, and then go into it with not a lot of uncertainty. So after we've had a long discussion about um, any medical history that my patient has or surgery history, medications and allergies, then we go into a lot of the fun stuff, which is basically, what cc's of implant will really look great on my body. What I found in a problem with people doing research on the internet is that they come in and they say, I want a 350cc implant. But what I do in my consultation is educate them and tell them that what 350 cc's looks like in that person you saw on the internet will look completely different in you. So what this software helps me do is really have a nice conversation and educate patients about what to expect and dispel all those myths. So what happens in a consultation is I actually take several photos, and this simulator software actually translates those photos into a very exact 3D simulation of their body. And I even ask patients to take a look and see if this really matches their body. And virtually all of them say, yes, that's a very great representation. So what I like to do is after talking with a patient, having a nice in-depth consultation of what they're trying to achieve, what cup size, I place a set of implants in the simulator and see what they have to say about that. So in this patient, this was a 350cc implant, and she looked at it and she said, that's exactly what I want. And that's exactly the kind of response I like to hear. But it's okay if they said, no, I really don't like that much. I wish it was bigger. We can just take this software and make it bigger. And then I ask them to take a look at it and say, what do you think about that? And we can basically really get very exact, down to the exact implant that we're going to use on the day of surgery. And that's a great thing to have this kind of tool to give patients really the certainty and the comfort of what they're going to look afterwards. So going back to the original size, um, this looks to me like a medium to small C cup. I can see what different views are. I even have basically 3D goggles where patients can actually see themselves. I can put clothes on and simulate what those implants, those new implants would look like underneath clothes. I even have a photo of what my patient looks like afterwards. And as you can see, she has a nice result. This was implants placed underneath the muscle with an incision underneath the fold. And going back and forth, you can even see how closely the result looks like compared to the simulated implants. So a really nice way for people to know exactly what they're going to look like after surgery. Obviously, it's a simulator software. It will never completely replicate what happens, um, but it really starts the conversation going. Make sure that we're both on the same wavelength about what implants will work best for that patient, and it makes it so much easier to have that conversation. So again, one of my favorite surgeries to do, and I love to have people come in and try out their new implants on the screen. So the last thing I want to talk to you about is what to expect after surgery. Like I mentioned in the first segment, the surgery is about an hour and a half. You spend about an hour in recovery, but you can go home the same day, eat at the dinner table, watch TV. Patients I find are very comfortable, and I know that because I talk to everybody the day after and see how they did overnight. Some patients are able to go for a walk. Some patients are able to go out to dinner that night. But in terms of what to plan, I like to tell patients it's a good idea to take a week off from work. It gives you enough time to recover. In terms of exercise, you can start doing some like jogging about a week after the surgery. It's really on when you're comfortable and how comfortable you are. Everybody's different. Um, the main restriction is I want that pocket that we've created for your implant to be stable, so to refrain from push-ups or a lot of motion in the pectoralis muscles for about 2 to 3 months. But other than that, you can go back to work, you can lift things, and we can have a more in-depth conversation about what to expect because everybody's lifestyle is also different. So thanks. Come on in, give me a call. We'll have a conversation about what's great for you and talk about the different implants. Place your photos in a simulator. Check out our website. You can see more information about implants. And it was great talking to you. Thanks.